Hello, friends. I'm Dr. Mukhmohit, and I welcome you to this AIIMS November 2018 MCQ discussion. So, first of all, I would like to share with you that I'm immensely happy that all the MCQs, all means almost every MCQ, all 100% of the questions were from our classes, that is PSM simplified classes, and all the MCQs were also from the book which is there, that is Conceptual Review in Community Medicine in PSM by CBS Publishers. So it gives me immense pleasure to share with you that this time all 100% of the MCQs were from our classes. And in fact, I want to give the credit to the content. I would give to the credit to the whole conceptual way by which you have discussed and in which you have actually understood community medicine. So let's go and discuss all the MCQs which came this time in AIIMS November 2018. The first question is a normal distribution curve with two small curves on comparison were shown. So there was a red color curve, which is the central curve, and there is a blue color small curves, which had two peaks. So the point to be noted is that if you recall from your normal classes that you had studied or from your knowledge that the center point would correspond to the mean, which is the median, which is also the mode. But in this case, the scenario is slightly different, that the curve that they had shown had two peaks. So what is this peak corresponding to? The peak will always correspond to the mode. What is mode? Mode is the number which is maximum frequency. So in the blue color curve, actually this blue color curve had two modes. They had two modes. It is a bimodal curve. So that's what you want, you need to remember, or you need to understand that there were two modes, and that is the reason that the mean and the median would be same. Can you appreciate this on this curve? The mean and the median would be same, but there are two modes over here. And obviously some of you might be thinking that because there is a mode 1 and there is a mode 2, why not we take the center of the modes, and therefore we can say that mode is also equal to the median. But unfortunately, mathematically this is not done, because technically speaking, what is mode? Mode is the number which is maximum frequency. So if mode is the maximum frequency, and if there are two modes, for example in this curve, this first mode is, let us say, number 9, and the second mode, let us say, is number 15. You cannot have an average that number 11 or 12 was the maximum frequency. That is wrong mathematically. In this curve, the maximum frequency was for number 9 and 15 equally. So it is a bimodal with some mean. Let us say that the mean was found to be 11.4 and the median was also 11.4. That's how this curve would look like. So it is a simple question which was trying to test your concepts in biostatistics. So we would like to go with this simple option, mean equal to median, which was not equal to mode. Next MCQ. So I'm again very happy to share with you the MCQ which is there from our Conceptual Review in PSM book, page number 392. In a clinical trial, the blood pressure was measured in two independent groups following treatment. Which of the following is the test of significance? So you can understand that in two independent groups, if you see that in two groups, the test of significance is unpaired t-test. The test of significance is unpaired t-test. And if the same question was there, I got the review from the students that probably there were two questions, but nevertheless, there could be two questions or there could be one question. Anyways, I have taken both the questions. In this question, we are discussing that there were two independent groups. So if there were two independent groups, I would certainly like to go with the option of unpaired t-test. When do you think I should mark the option for paired t-test? I will mark the paired t-test if the question says before and after in the same group. When would you like to mark ANOVA? I would like to mark ANOVA. What is ANOVA? Analysis of variance. Analysis of variance. I would like to mark an OVA if the test is quantitative data, that is a parametric data. So it's a parametric test of significance for quantitative data which has 3 or more than 3 groups. When would you do a Mann-Whitney U test? Mann-Whitney U test is done maybe for usually taken up for qualitative data, or in other words it's a non-parametric data and which is ordinal. So in those areas you would like to go with the Mann-Whitney U test. So question number 3. In a clinical trial, the blood pressure was measured in the patients before and after. So actually there might have been 2 questions probably. I'm not very sure on this, but nevertheless I have discussed both the options. So the answer would be a paired t test. Whenever the question is saying in the same group, it is before and after. So next MCQ. I think question number 4. So we are happy to share with you page number 362 from our book, Conceptual Review of PSM. 2 screening tests were done in series. What will be the sensitivity and specificity? Please remember that if the test is done in series, there are multiple tests. You have test number 1, and then you'll have test number 2, and then you'll have test number 3. If you do 1 and 2 and 3, you do 1, then 2, and then 3. If you do all these 3 in series, please remember in series the specificity of the whole system. Test 1 will have its own sensitivity, specificity. Test 2 will have its own sensitivity, specificity. Test 3 will have its own. So whenever you combine them in series, the total specificity is going to increase and the sensitivity is going to be dropped. But in case you take test 1, test 2 and test 3 all together at the same time, that is, you are deploying them as test in parallel. So if you are deploying them in test in parallel, the sensitivity would increase and specificity would probably decrease. So having kept this in mind, the 2 screening tests were done in series. What will be the sensitivity and the specificity? In test in series, the sensitivity decrease and specificity increase is the right answer. So I'll go with option number 1. So if we see the next MCQ, that is question number 5, refer to the image below and mark the correct answer. So they had actually given a box and whisker diagram. So as you can see, the box and whisker diagram. So in a box and whisker diagram, they had actually probably given something like this, that the box is maybe the upper portion is elongated, then you had this, then you had smaller this. So what type of data is this? So if I just turn this box and whisker like this in right 90 degrees, so don't you think this box and whisker will look something like this? That is what this, if I just turn this thing on the right side. So if I turn it on the right side, this box and whisker looks like this. You know that from, as you can see from the box and whisker cutout also, that each part of the box and whisker, each part, so there are 4 parts, right? 1, 2, 3 and 4. So you have part 1, part 2, part 3 and part 4. Each part corresponds to 25% of the population. So in this box and whisker, can you appreciate that most of your population, 75%, is in the lower zone and only 25% is towards the higher part. If I take on this axis, this is 5, this is 10, this is 15, this is 20, this is 30 and so on. Maximum population is within this. So it is something like this. Can you appreciate this? So if you take this as a normal distribution curve, as a distribution curve, not a normal, as a distribution curve, you can see that maximum population is in the early part of the data and very small is in the later part of the data, which brings us to the point that this is a skew. So what sort of skew? Please remember the tail is towards the right. This is a right skew or a positive skew. This is a right skew or a positive skew. So this is what this skew is, and probably they had shown something like this. There were some interquartile ranges. Each value, please remember each value, each box. So in a box and whisker, if you see like this box and whisker, in a normal box and whisker, each part will correspond to 25%. So from this point to this point, 25% of the population. This point to this point is again 25%. This point to this point is again 25%, and this one is 25% of the population. So the answer over here we would like to go is it's a positively skewed data. Question number 6. Dosage for levonorgestrel as emergency contraception. So as you can see that the dose for levonorgestrel is 1.5 milligram as single dose. So now we have 1.5 milligram single dose levonorgestrel. Please remember earlier we were giving 0.75 within 72 hours, another 0.75 within 12 hours, not 24 hours. So it was 0.75 within 72 hours, another shot of 0.75 milligrams within 12 hours of first dose. So that was what was earlier followed, but now it is preferred to be following as 1.5 milligram as single dose. So we would like to go with 1.5 milligram as single dose option. Isolation for measles is done as. So as you can see in our book, this question was also there. It was a direct question, so that the isolation of measles is till third day of the rash. So from the onset of the symptoms to the third day, we call that as isolation period for measles. Please remember measles is different. The isolation is different from the period of communicability. It is said that the measles is communicable 3 to 4 days before rash, 3 to 4 days before happening of the rash, and till 3 to 4 days after the rash. So that is the reason we have the isolation period in this time, because before the rash you don't even know which person is going to have measles. So that is what this question was, that isolation is for 3 to 4 days after the rash. So question number 7 is this, and question number 8. So let us come to question number 8, maternal mortality ratio. I think this question is one which we discussed so many times in the class, that there is a difference between what is maternal mortality rate and a maternal mortality ratio. So as you can see, I highlighted this in the book as well. So can you see this in the box I had given? Good to remember box and high yield box. What is maternal mortality ratio and what is maternal mortality rate? So I'm in fact very happy and proud that the same question was there in the exam as well. What is maternal mortality ratio? Again, we had given in the exam, in the book also. Maternal mortality rate is different and maternal mortality ratio is different. What is maternal mortality ratio? Maternal mortality ratio is number of maternal deaths divided by total number of live births multiplied by, it could be 100,000, it could be 1,000 also, but in India we always take expressed as per 100,000. In some countries they take it as per 1,000, in many countries they take it as per 100,000. So in India we are going to take it as per 100,000 live births. So please remember maternal mortality ratio is number of live births? So this question had been done so many times in the class as well. So I think it should be an easy, must have been an easy cakewalk for all of us. Next MCQ, question number 9. So this question was particularly quite in controversy over the social media, that if you had accidentally spilled blood while collecting samples, or some students were saying it was about the blood transfusion. So anyways, the next best step is, so they're not asking what is the way of, the question did not ask that what is the mechanism for disinfection of the floor. So if the question was about the disinfection, I would have loved to go with sodium hypochlorite, but they had simply asked about the next step in management. So mind you, the next best step in management would always be, you catch hold of tissue papers, you catch hold of napkins, you catch hold of bed sheet, you catch hold of any absorbable thing, and you just soak it over there depending on the quantity of the blood which is spilled over the floor. So you'll put up any object absorbable thing, and you try to absorb the maximum blood from the floor. And once the blood is absorbed, you have to have a disinfection strategy or a plan for disinfection of this object as well. Now you will send this object for disinfection, and the floor would be disinfected with a hypochlorite solution. So I would like to go with option number 2. Of course, you're not going to waste time in calling hospital management team or mop it, is absurd options. So the best option would be cover with an absorbable object. So that will be the next best step you would like to do. If we come to question number 10, next MCQ is question number 10, that if the transfusion blood bag is disposed of in which color. So I think this was there in my YouTube videos. This we had discussed so many times in the class as well. It's there in the book also, which was like a conceptual review in community medicine. So the blood transfusion, please remember, would go into yellow color category. So the blood bags are disposed of in yellow color category. In the red category, you have anything. In the red category, you have anything which is rubber, which is tubes, or which is plastic. So anything which is rubber, tube, or plastic will be thrown in the red bins and taken as the red category, but blood bag is an exception that you put it in the yellow category. Please remember that items containing blood or fluids and contaminated with blood or fluids, they are all going to the yellow category. Question number 11. So question number 11, what is the life cycle shown below? So there's you can see in the image there was a picture of a pig, of some bats which were there. So there were pigs and there were humans and there were some people who are getting infected. So it's a clear-cut example of Nipah virus. So in May 2018, India witnessed a big massive epidemic of Nipah virus, concentrated more so in the state of Kerala, in Kerala in May. And this Nipah virus had infected hundreds of people. And we all know that Nipah virus, there are 3 models of transmission of Nipah, that is from human to human. We can also have from pig to human. We can also have from bats to human. So human to human, pigs to human, or bats to human. Which are the bats which are implicated? It is the genus Pteropus, which is implicated in the transmission of Nipah virus. So Nipah virus life cycle they had asked about. So the next in line we have is question number 12. You can see that all of the following are newly included vaccines in the immunization schedule except, so rotavirus, influenza, adult Japanese encephalitis, and measles, rubella. Rotavirus, we all know rotavirus is a live oral vaccine. It is a live oral vaccine. It is given at 6, 10, and 14 weeks in a child. So it is given as per the national immunization schedule, and it is very much into the schedule. That is rotavirus vaccine, which is live oral. It is given at the rate of 5 drops in each session. The next vaccine we have is influenza vaccine. Influenza vaccine is not, as per as current status for the Indian National Immunization Schedule is concerned, influenza is not a part of the vaccine program. Next we have is adult JE. So adult JE, I would like to point out that Japanese encephalitis has been approved for most of the states for children below 15 years. But in some certain endemic districts, this is a new update. In certain endemic districts, JE has been approved for people in adulthood as well, in special in state of Assam specifically. And so JE adult can be the right answer, but let's see. And measles rubella, it's obviously MR vaccine is a it's a full blown project that NIS is witnessing right now. So if out of all these vaccines, if you see about the rotavirus influenza vaccine and adult JE and the measles rubella, I would like to go with influenza vaccine or the flu shots or the flu vaccine. So we might get confused with H influenza, that is Haemophilus influenza B, Hib vaccine. But if you take adult JE, if you compare adult JE and influenza, you would obviously take this as flu vaccine. So flu vaccine is not a part of the Indian National Immunization Schedule. Flu vaccine, just for you to know that flu vaccine has many types. We can have inactivated influenza vaccine. We can have an inactivated influenza vaccine, or we can have a recombinant influenza vaccine, or we can have a live attenuated influenza vaccine. So we can have also trivalent or quadrivalent flu vaccines, and it is specifically given in a few countries in like US and Canada, and all other places, like most of the places, influenza vaccine is like it's optional by the public health authorities. In India, influenza vaccine is not used. Now question number 13. The test to identify the damaged vaccine due to over freezing. This is again from our classes. We have done it so many times that we talk about whenever we talk about DPT vaccine, diphtheria pertussis tetanus vaccine. It has an adjuvant that is known as aluminium hydroxide. So this aluminium hydroxide, in case of freezing, this aluminium hydroxide would precipitate, and if it forms a precipitate, this renders the DPT vaccine as non-potent. So if your vaccine is non-potent, it's not going to kill the germs, it's not going to give you the adequate immunity, and in fact this vaccine becomes more harmful rather than giving you a protection from diphtheria pertussis tetanus. And therefore we always check for DPT vaccine using a test that is known as shake test. Hubble test is for checking the potency of a rabies vaccine. Hubble test is for rabies vaccine. Inactivated rabies vaccine, we check for the potency of the rabies vaccine. So that's not related to the over freezing. Over freezing, we do it using a shake test. So next is the midday meal program will supply. So you can see in our book on page number 86 in Conceptual Review Community Medicine, midday meal program. This is an old MCQ. We always talk about it in the classes that we are supposed to give 1/3, that is 30% of the energy requirement, and we will give 1/2, that is 50% of the protein requirement. So under the midday meal program, so it goes around 1/3 of the energy and 1/2 of the proteins. So we would like to directly mark the option number 1, that is 1/3 of energy and 1/2 of protein. This image refers to, it's like a very easy question. It is not radiation, it is not cytotoxic waste. Why? Because cytotoxic waste would be something like with the symbol C. It is not biomedical. Why? Because biomedical would be with a claw shaped symbol. It's not electronic waste, it is a radiation hazard. So it is a symbol for radiation hazard. So question number 14, and now you have question number 15. So let's go to the next MCQ, that is question number 16. The image below this is a repeat MCQ. So from the previous exam also we had a similar question. So the only point for you to remember is that you're looking at brown colored tablets with white colored tablets. Can you see them? So these are white color tablets, and then you have these brown color tablets, and in this you have only the white color tablet. So this green color is for adult leprosy multi-drug therapy, multi-drug regime packets. So it is, these are MDR, multi-drug regime for paucibacillary adults, and this one is for multibacillary. You can see the brown color tablets. The brown color tablets, these are nothing but clofazimine tablets, and the white color tablets, these white color tablets, these are the dapsone tablets. So this is what I have shown you in this diagram. These white color tablets, these are same as dapsone tablets. So that is about question number 16. Question number 17. A health center reports 40 to 50 dengue cases in a week in a community normally. So normally there were 40 to 50 dengue cases. This week there are 48 cases. These cases are endemic, pandemic, outbreak, or sporadic. Sporadic is like scattered, outbreak is too much high, epidemic, pandemic is involving large populations, usually involving large continents. So the best answer would be direct MCQ. It's an endemic. What is endemic? It is persistent number of cases. That is endemic. Next question 18. BCG vaccine provides protection from. So BCG vaccine provides protection from disseminated TB, that is severe forms of tuberculosis. Also, it provides protection from bladder cancer. So again, I'm happy to share with you page number 429 from our book, page number 429 from our book about the BCG vaccine, again from the book. Question number 19. Which of the following is true for the treatment of MDR? So all the students attending my class, you will be able to recall my formula for COGZ. You recall COGZ. So how many drugs you see in COGZ? You see 1, 2, 3, 4, 5, and 6. So I would say 6 drugs we give as intensive phase, plus we give COEE, COE, and this is 4 drugs in the continuation phase. So of course we are going to mark a very easy question. It is given 6 drugs for minimum 6 months, and then we give 4 drugs for 18 months. So that is the treatment we give for multi-drug resistant tuberculosis. Again, I'm happy to share page number 480 from our book. So it is 6 drug regimes and 4 drug regimes. So we would like to go with option number B. Next question is again from tuberculosis, question number 20. A child on anti-tubercular drug regime now, I think it's not no, it's now presents with visual disturbances. The drug most often implicated is streptomycin, ethambutol, kanamycin, and rifampicin. Kanamycin is one drug which has some renal toxicity, so you need to be very much aware about the renal side effects of the kanamycin. Streptomycin again has renal toxicities. It also has ototoxicity. Ototoxicity, it causes sensory neural hearing loss, and renal toxicity. Rifampicin is an enzyme inducer, and it is also associated, rifampicin is also associated with orange discoloration of body fluids. Ethambutol is one drug which causes ophthalmotoxicity. And this ophthalmotoxicity is in terms of optic neuritis, or there might be a color blindness. So it might lead to color blindness or optic neuritis, which might be causing these visual disturbances in this child on ATT regime. Next, we would like to come to question number 21. Phase 1 clinical trial is done to find the effectiveness, dosage, assessment of rare side effects, and drug safety and toxicity. See, in phase 1, this is kind of question which has different answers if you go with the options. So I'm not very sure with the options. But anyways, phase 1 is one which is where you do it on a very confined number of individuals, very small number of individuals, mainly to determine the pharmacological action, mainly to determine the pharmacological action of the drug, and to check its basic effectiveness, to find the dosage and safety and the toxicity. In phase 2, we shall do it on considerably around 100 to 200 individuals. This phase 2 is done on this slightly bigger individuals to assess for primarily the effectiveness of the drug in slightly larger people, in slightly larger number of people, and also to find out the potential. It is also to find out the potential side effects at different dosages. So primarily the dosages, and to find out the maximum or the minimum tolerable limits. We have phase 2 trials. Phase 3, these are again, they are controlled or uncontrolled trials, and that is again for assessing the effectivity of the drug in very high amount of much larger populations, where you are going to assess the effect as per the how the physicians give the drug. So it is on a bigger, it's much bigger, and typically these are like very large. They might range from like something around 200 to maybe 5,000 or 40,000 individuals, and they are the usual market of the drug is done. And phase 4 trial is what we call as post marketing. Once it's launched in the market, now we are going to check for the rare and serious side effects. So rare serious side effects which may be coming after very long time, it's again phase 4 trials. So once the drug is launched into the market, then also there might be some side effects which are coming. That is done using the phase 4 trials. Phase 3 are on much larger populations, usually at the marketing level, and it is conducted in bigger amounts. Dosages, it's done in phase 2 and phase 1. I would like to go with drug safety and toxicity. Out of these, effectiveness would go into stage 2. Dosage would also be stage 2. Rare side effects, we will go with phase 4. So phase 1 would be primarily drug safety and toxicity side effects. So next if we come to is question number 22. Spike's protocol is for counseling for breaking bad news to a patient. Spike says setting up for an interview. Spike says setting up for an interview for assessing SPIKES. Spike is setting up the interview. P is to assess for the patient perception on what they feel, at what level of comfort they are. And that's very important because you need to assess for the patient mood and how's he going. You need to predict on how's he going to take the bad news. I is obtaining the patient's intent or invitation about his how does he want to receive the news. In case he's ready to receive the news, only then we are going to open it. Otherwise, we may ask the patient to come back at a later time. We make a counseling session. And K is for knowledge, what knowledge they have. E is for emotions. And last is S is for strategy and summary. So the Spikes protocol is for breaking bad news, and it is not for consent or participation. It is not a triage strategy. Question number 23. What is not included in the WHO Mental Health Gap Program according to the Mental Health Act? Again, we are happy to talk. It was there in our book on in conceptual review of PSM, page number 694. We had Health Gap Act action program. So Health Gap Action Program is primarily for giving the pharmacological treatment to people who are impaired by the distress or political distresses, who have seen much adversities because of maybe bad politics or maybe because of some social issues. So that this whole mental health gap program is basically for the developing countries or low or middle income countries where people has gone through bad phases. So it is for mobilization, giving them social support, giving them interpersonal therapy, but not for screening members. It's not going to screen people for any psychiatric illnesses. It is basically for providing management and treatment for depression or for other neurological diseases, and to provide them constant support, social support. And that is what this mental health gap program was. So with that, I'd like to close the session, and all the very best to the students. And you are more than welcome to visit us on our YouTube channel for more lectures on Mukhmohit's Community Medicine YouTube channel. Or you can find me on Facebook in a group that is Mukhmohit's Community and Medicine Discussions. That's a Facebook group. And on Telegram, you can follow this link and you can join for recent updates in community and community medicine. So all those interested for USMLE and Medical Council Canada classes, we are holding special classes in Canada as well as in India. So you can join them for the lectures, maybe online, or maybe you can have a group of students who can join these lectures. And for PSM classes helpline, you have the numbers. All the very best, and may you all score very, very nice in your future exams. And I wish you all the very best. May you come out with flying colors. Thank you so much.